Amphetamines have been amongst the most widely consumed substances globally for decades. These stimulant drugs induce alertness, euphoria, and a sense of empowerment in users. They gained popularity in the 20s when synthesized for medical purposes like treating asthma and respiratory issues. During the 30s, amphetamine abuse emerged as it became available in over-the-counter inhalers. The Second World War notably saw it used to combat fatigue among soldiers, engaging mood and endurance. By the 50s, amphetamines were widely prescribed for obesity, depression, and fatigue. However, their highly potential for abuse and addiction became apparent over the time. In the 1971, amphetamines were internationally regulated under the International Convention of Psychotropic Substances. Between the 1980 and the 1994, young worldwide saw a rapid increase in amphetamine use. Presently, amphetamines are primarily prescribed to treat conditions like ADHD and narcolepsy.
Amphetamines are stimulant drugs which speed up the messages traveling between the brain and the body and increase dopamine and serotonin levels. The effects can be felt immediately or within 30 minutes. The short-term effects typically manifest soon after ingestion and can last for several hours, but they vary depending on several factors such as dose or individual tolerance, etc. Some of these immediate effects are a burst of energy, enhanced concentration, loss of appetite, which is a reduced feeling of hunger, increased heart rate and blood pressures because amphetamines stimulate the cardiovascular system, resulting in elevated heart rate and increased blood pressure, hypertension. These physiological responses are characteristic of the drug stimulant effects. Dilated or large pupils, sweatings because they increase the body temperature, dry mouth, jaw clenching and teeth grinding, happiness and confidence, nosebleed and damage to the nasal passage from snorting, and better physical performance. These short effects may be desirable for some individuals, but the bad usage or abuse of amphetamines can lead to serious problems of health and adverse consequences. The long-term effects of amphetamines can be diverse and harmful, especially with prolonged use or misuse of the drug. These are extreme weight loss and malnutrition, which is appetite suppression is the main problem, amphetamine psychosis, dry mouth and dental problems characterized by tooth decay, gum disease, tooth loss, regular infections such as colds, flus due to reduced immunity, drug dependence, out-of-character behavior, exposure to amphetamines can lead to structural and functional changes in the brain, mood swings, panic attacks, heart and kidney problems, etc. These long terms can be different for individuals and may depend on factors such as dosage, frequency of use, duration of use, and individual susceptibility.
Amphetamines are stimulants of the central nervous system, so they speed up the body's natural functioning. At the point of addiction, your brain relies on having them to function properly. Withdrawal symptoms are abnormal physical or psychological features that follow the abrupt discontinuation of a drug that has the capability of producing physical dependence. Once consumers stop taking the drug, the brain and the body try to adjust to functioning without them. Symptoms appear in 3 different phases: the initial or crash, the intermediate, and the third phase. The consumption during pregnancy can carry effects on the baby, or even make it dependent of that drug. Amphetamine functions by increasing the amounts of dopamine, epinephrine, norepinephrine, and serotonin in the synaptic cleft. Amphetamine increases extracellular levels of dopamine, achieve the effect of them by enhanced dopamine release, inhibition of dopamine reuptake, and disruption of vesicular storage. Amphetamines also affect epinephrine and norepinephrine signaling in the brain, act as agonists receptors, and create a growth of these in different parts of the brain. Dopamine and norepinephrine also affect serotonin neurotransmission, but to a more extent. An excessive usage of amphetamines depletes serotonin reserve and increases the risk of depression and other psychiatric disorders.
The aim of this study has been the pediatric use in obsessive-compulsive disorder patients and its long-term impact on brain development. In 2023, a research was conducted. 2 independent examiners assessed completely interventional trials focusing on amphetamine use in children. In short, the study confirms that amphetamines work well for pediatric ADHD, but warns about possible side effects and addiction risks.